Good afternoon, everyone, and welcome to today's edition of Black Health Trust. We are so happy that you chose to spend this time with us, and we will move on into our invigorating conversation today by handing it over to our founder, Dr. Randall Maxey.
Thank you so much, Dr. Barbara Davis-Stevens. I want to speak just a moment about the word WOKE. It seems to be a buzzword. It was originally created by Black folks to talk about being aware of what's going on around you, being aware of what you need to do to protect yourself. But more recently, it's been perverted by other people as something that's a negative. But looking at it as a positive, I want to talk about things we need to be awoke about, we need to know about, we need to know about life and protect ourselves and our communities. So let's go to the first slide. Who's with us in terms of our co-host, Dr. Neighbor?
Dr. Hines is here.
Hello, Dr. Hines.
Hello.
Okay. So we'll jointly do these slides and go together. Let's go to the first slide, Simon. So we're going to talk about new developments and what it takes to really understand what's going on. And a lot of the stuff is going to seem repetitive because it is, because it all boils down to it's the same thing time after time with disease after disease of knowing that you need to have a good lifestyle, good eating habits, etc. So new medical research does show that small lifestyle changes are very important. Moderate walking, quality sleep, proper medical management, and all these significantly reduce the risk for heart disease, stroke, and cognitive decline. We say you need to get 10,000 feet of steps a day, but if you get 5,000 or 7,000, that is very helpful. Next slide. So why we crave food, I gave a talk in Boston at Harvard some years ago and talked about how I liked crunchy fried catfish. I like something sweet. I like something crunchy. So, but these cravings are biological and they also have emotional signals and they're influenced by culture as well as climate. Dopamine, which is a hormone produced in the brain, drives pleasure and motivation. Family habits shape lifetime taste and preferences. I know my mother is from South Carolina and she got me used to Southern food or soul food, which isn't necessarily good for me, but it's definitely good to me. And I haven't been able to break out of those habits yet. So family habits do shape lifelong taste preferences. Climate also affects appetite. Hot weather favors salt, cold weather favors carbs, but a balanced exposure to childhood promotes healthy relationships with food. Next slide. So, what is the sugar signal? Low blood sugar or fatigue triggers dopamine release. Emotional stress and poor sleep increases sugar desire. Health effects, in a positive sense, gives you quick energy, mood lift, supports brain function in moderation. On the negative side, obesity, diabetes causes fatty liver, heart disease, and dental disease. But as a cultural example of what you can do, Caribbeans have fruit desserts, and Africans have sweet potatoes or yams, and these offer natural sweeteners. Next slide. Dr. Neighbor-Stevens, will you take these next two or three slides?
Sure. So salty cravings, the mineral messenger, It happens when we get dehydrated or we're under stress and our sodium lowers in our levels lower in our bloodstream. Salt enhances flavor satisfaction. The health effects are that on the positive side, it helps to maintain dehydration. It helps to maintain hydration and therefore prevent dehydration and nerve functions in moderation. Negative effects are too much salt, raise blood pressure, and cause strain on the kidney. On a cultural note, traditional soups and stews use natural herbs instead of added salt. Next slide, please.
Gonna take that one.
Crunchy and fatty cravings, texture, and stress relief. Why does this happen? Crunching reduces tension and stress. Fried or crispy foods are tied to comfort and habit. Health effects of this include the eating of nuts, seeds, and vegetables that satisfy that crunch need safely. Negative health effects, fried foods create acrylamides and inflammation linked to heart and brain risk. Cultural example, roasted plantains or baked cassava chips are healthy options to satisfy that need for crunch.
Dr. Hines, you take the next one?
Sure. Family, culture, and climate influence. Parental eating habits shape taste preferences early in life. Cultural pride in food can protect health when it's balanced, and climate, such as heat, increases salt needs, cold increases your desire for carbs and sweets. Healthy cultural dishes. So, in the Mediterranean culture, olive oil, grilled fish, and vegetables are common. Caribbean culture, beans, rice, plantains, tropical fruits. African culture, millet, greens, lean stews. And in Asian cultures, fermented foods and green teas are good for gut health and heart health.
Go ahead and take the next one too.
So the health impact. So sweet foods will give you an energy boost, but they increase your risk for things like diabetes. Salty foods help with electrolyte balance, but too much can increase your risk for hypertension. Crunchy or fatty foods, they may help relieve your stress, but they come with a risk of inflammation. So here's some healthy alternatives. Replacing your refined sugars with fruit to satisfy your sweet cravings. Using herbs and spices instead of salt, and choosing baked or air fried foods over deep fried foods.
Is Dr. Lawson on with us? Is Dr. Lawson on?
I don't see him.
Okay. So, number 7, how to manage and balance cravings. Eat regular balanced meals with fiber, protein, and healthy fats. Hydrate with water and natural juices. Sleep well and reduce stress. Respect cultural foods while modernizing preparation. That's what I had to learn. Model healthy habits for children. It's very important. I've seen mothers take beech nut, Gerber baby food and put salt and pepper and butter in it to make it fit the mother's taste, and that's really not good. So make sure we're teaching our kids right. Dr. Barbara David Stevens takes the next one, number 8.
Key takeaways. Cravings are normal signals, not failures. Understanding biology, culture, and climate empowers healthy choices. Balance tradition with science for lifelong wellness.
So let's talk about preventing. The next sign is prevent diabetes. So what is pre-diabetes? We have that. People say, I'm a pre-diabetic. I'm not a diabetic. But it means that blood sugar is higher than normal, but not yet diabetes. The A1C ranges from 5.7 to 6.4. The fasting glucose of 100 to 125 milligrams per deciliter is common in overweight and sedentary people or people with a family history. So why it matters. Do you want to talk about this, Dr. Hines?
Sure. Is there a next slide? Okay,
Next
there we go. Without changes, 70% of people will go on to develop type 2 diabetes. And addressing your type 2 pre-diabetes can help avoid heart, kidney, and vision complications. I have found in my practice, a lot of people get stuck at pre-diabetes, right? Like they say, I've got pre-diabetes, and then the numbers have changed, but their mindset on what they have hasn't changed. I will say that now people, I think, are more aware of what pre-diabetes means and that there is oftentimes treatment. People will recommend getting on diabetes medicines to help reverse your pre-diabetes before it becomes diabetes, in addition to obviously the therapeutic lifestyle changes that need to take place.
You go take the next 2 slides if you would.
So the main risk factors for prediabetes, which are the same as for diabetes, are being overweight, having a positive family history for diabetes, having high blood pressure, abnormal cholesterol, low activity levels, being over the age of 45, being of African American, Latino, or Native American ancestry.
That's Neighbor Stevens. Next slide.
Diagnosing prediabetes. Number 1 test is fasting blood sugar. Number 2 is hemoglobin A1C levels. Number 3 are oral glucose tolerance tests. And 4, regular checkups are vital for early detection.
And take the next 2 slides if you would.
Preventing diabetes. Lifestyle first. Your diet needs to be adjusted to contain whole grains, vegetables, fruits, and lean proteins. You need to exercise. You want to try to get 150 minutes in each week. That is a moderate exercise. Weight loss. You want to lose 5 to 10%. If you can pull that off, you can reduce your risk by 50%.
You go into the next 2.
What is prediabetes? As we said earlier, it's a blood sugar that's higher than normal, but not quite in the diabetes range. An umbrella term based on lab tests, either the hemoglobin A1C, the fasting blood sugar, or the 2-hour oral glucose tolerance test, is how you arrive at that determination. A warning sign to you to give you an opportunity to prevent moving on to full-blown diabetes and prevent all of the complications that go along with that.
Can I just jump in here for just a moment? Because this is also right here at this pre-diabetes stage, what that's going to look like in your labs, like when your doctor does your blood work, that's going to be when you get that blood sugar or that glucose level that says like 98, 99, 102, 103. It's the numbers in that range that oftentimes go, oh, you're almost there, right? And then people go, do something, but they don't often take those seriously. Take those seriously, right? Because that's when it's still a warning. If you are right there at that borderline, you are in the pre-diabetes category. And if your provider doesn't take it seriously, this is an opportunity for you to know that you should take that seriously. But that is oftentimes where you will see people who had this track record. When you go back and look at their labs, it went from 96 to 99 to 102 to 105 to 120. And over the course of years, you can see them transition from pre-diabetes to diabetes, and nobody did anything until they were officially a diabetic.
And once you just take the next slide with your southern accent.
So a normal A1C, a hemoglobin A1C, is a test that's used to speak to your average blood sugar over the last 3 months. So a normal is less than 5.7%. Pre-diabetes is anywhere from 5.7% to 6.4%, and diabetes is 6.5% or higher. A fasting glucose, like I said, less than 100 is considered normal. Pre-diabetes is 100 to 125, and then diabetes is greater than 126. A 2-hour glucose tolerance test, and these aren't used very often anymore because you have the hemoglobin A1C. But if you do do a 2-hour a 2-hour glucose test, having a result less than 140 is normal. Pre-diabetes would be a result of 140 to 199, and diabetes would be a result that is greater than 200.
Okay, why don't you take the next one, because it's relevant
Sure.
to what we're talking about.
So why more than one test matters? Impaired glucose tolerance or high after meal sugars can predict higher risk. So combining that A1C with the fasting glucose or 2-hour glucose tolerance test can catch more people that are at risk. If the two tests are at normal, then the risk is higher and you want to act sooner. So oftentimes what the combination that you'll frequently see is people are getting their routine blood work, right? With their fasting blood sugars, oftentimes because they're checking on cholesterol and things like that. And then when those numbers, like I said, they're 102, lots of times you will see your provider follow that up with a hemoglobin A1C. And then, like I said, that number captures that range across 3 months. And if you are having highs and lows, especially in those, after meal sugars is the first place to go abnormal. So you can have, pre-diabetes and still have fasting blood sugars that are still normal, because the first thing that is affected is your after meal sugars, and then your fasting sugars begin to move into the abnormal categories again, typically, right? Everybody's an individual. But that's why you're using that combination of tests. And then that 2-hour glucose test is just like I was saying before. It's that challenge that's meant to mimic having had a meal, and what does your body do with that sugar after that meal.
Okay, let's go to the next slide, Simon. So we want to focus on medications and complications, and we want to prevent what's going on. We want to prevent hypertension, we want to prevent heart disease and stroke, especially chronic kidney disease. Somebody was asking about that earlier. And steatotic or fatty liver disease that happens, heart failure with preserved ejection fraction, and nerve damage and eye problems over time. Let's go to the next slide. Dr. Neighbor-Stephens, you want to take this one?
Okay, so not all prediabetes is the same. The typical form is what is known as is characterized by what is known as insulin resistance. But there are other forms. Autoimmune, which is pre-type 1 diabetes, can happen at any age. Pancreatic, after pancreatitis or pancreatic disease, there can be alterations in the blood sugar level because insulin is produced by the pancreas. And so if the pancreas is damaged, then it is subject to not being able to produce insulin and or react to the need for insulin in the normal physiologic way. And finally, there's hormonal, Cushing's, acromegaly, and other conditions that are created by hormonal changes in hormone levels.
Take the next one, please.
Pre-type 1 diabetes, when to consider testing. There's a personal or family history of autoimmune disease, such as vitiligo, where you, because of the autoimmune um, reaction in the body, the melanin, which is what is gives you pigment, is this melanocytes are destroyed. Or in Hashimoto's, which is a condition where uh, there is an attack on the tissue in the thyroid by the body. Rheumatoid arthritis, where again the body attacks the joints, and IBD, which is irritable bowel disease. It's kind of an umbrella um, term, but where there may be an autoimmune reaction where cells in the gut are attacked. Then there are more positive antibodies. When there are more positive antibodies, then there's a higher likelihood that what you're dealing with when you see these high uh, hemoglobin A1Cs or almost abnormal blood sugar levels, it's probably a form of type 1.
May I ask you a question, Dr. Neighborton?
Mhm.
Does albinism have anything to do with this?
Not that I'm aware of. That's a different situation. That's a genetic situation.
Okay. So is type 1 a genetic situation?
Very well can be. There's a higher incidence depending on which form of type 1 you're talking about. There's a definite genetic connection with type 1.
Okay. Next slide shows what helps the most. And then it's graphed on the far left-hand side, you see the lifestyle changes are most effective. Next is pioglitazone, which is a drug that's used, and then metformin. But lifestyle changes, if you notice that is the most important thing. Dr. Hines, we do the next one.
Treatment and prevention options. Lifestyle. So regular physical activity, like we talked about earlier, trying to get to 150 minutes a week of moderate activity, weight loss, that 10 to losing 10% or 15% of your weight, fiber-rich foods, getting adequate sleep, managing your stress, all of those things are preventative measures. Metformin, which is a medication that is proven to lower diabetes risk, is often a first-line medication. It's an oral medication, been around a long time. Pioglitazone, 15 milligrams, there's evidence for benefit in prediabetes. It can also be helpful in avoiding heart failure or for those with significant fluid retention. And then in addition to those, there's also making sure that your blood pressure is normal, that your lipids or your cholesterol are at the goal levels, making sure that your liver stays healthy, which is largely tied to the habits that you have, including limiting alcohol. And if you're smoking, stop smoking.
I don't know why you started in the first place. Next steps. Go to the next slide, please.
We listen, but we don't judge. That's what the kids say, right? We listen and we don't judge.
Know your numbers. That's very important. Know your A1C. And A1C is the one number that's very difficult to cheat on because that's an average of what goes on for the 90 days prior to the test. So you can't all of a sudden take some insulin or take some spinach and it'll go down. You also should know what your fasting glucose is. And if you're advised, get the 2-hour value of the oral glucose tolerance test. We want you to set a 3-month action plan for what food you're going to eat, what movement you're going to do. And with that movement, there are 2 types. There's the cardiovascular, which is trying to elevate your heart rate. There's also resistance, where you either use weights or rubber bands of some type to use strength. Get good sleep and get rid of so much stress if you can. I know that is not a good time for stress right now. Also, know what medicines you need to take if lifestyle alone isn't enough. Follow your laboratory and prevention of complications. Very important with diabetes, especially not to let complications get a hold of you. Dr. Neighbor Stevens?
Can I just also add while you're talking about those next steps too, that there is also benefit just to exercise. Even if you don't lose any significant weight, there is still benefits and preventive benefits just from the exercise. Obviously, it's not as much as if you lose weight, but lots of folks who are on that weight loss journey get very discouraged. But there's a benefit even if the scale doesn't change much.
Next slide, Dr. Neighbor.
So medications that can be used in pre-diabetes. So you're probably saying, why are you going to take medicine if you don't have diabetes? Which is a good question. So the ones that are used most commonly would be metformin. It's been around for ages. It's common, it's safe, and it's affordable. The new kids on the block are moving in and are have been shown to help primarily because of the weight loss. And those are the GLP-1 drugs known by trade names Ozempic, Wegovy, Mounjaro, which help weight and manage blood sugar. They were originally designed or marketed for the lowering of blood sugar, but it was observed that there was weight loss. And in a country where obesity has the levels that it has, certainly the ability to help with weight control was and is attractive, and probably has overtaken the drive for the use of these drugs.
Why don't you go for the next couple of slides?
While you're on those, there's a question about is there a role for these GLP-1s in type 1 diabetes?
Well, remember now, in type 1, although the two could coexist, you could have type 1 and have issues with obesity and weight. Generally, that is not what the issue is. It is either the hormonal or the genetic, and it can be either a direct genetic, and when I say a direct genetic, an actual gene, but also it has been found that in type 1, it's one of those conditions that can be affected. The gene can be there, but it doesn't turn on until something else happens in the individual's life that turns it on. And in children, where type 1 was originally identified and the early work was done, there was an association identified between the onset of certain viral illnesses and the later onset of or the development of the blood sugar abnormality. So it's complicated. And as we talked about earlier, there are 4 different classes of type 1. So different things can have different impact.
But as a general rule, we don't recommend GLP-1 for type 1 diabetes.
Correct. Because we're not really dealing with the weight issue. And more importantly, the bigger reason, I suppose, is that there's more of a chance of hypoglycemic episodes.
Yeah. Go take the next couple, Barbara.
Preventing complications. Well, you want to monitor your blood pressure regularly. And when you're monitoring your blood pressure, try to be consistent in when you do it, because normally your blood pressure varies at different times of the day. So you want to be consistent in when you do it, not one day do it in the morning and the next day at night and then skip a couple of days and then come back. Try to be consistent every day. Cholesterol management, we've talked about that. Monitoring, well, you won't have to monitor your hemoglobin A1C, but make sure you keep your appointments so that your physician can monitor your hemoglobin A1C. Absolutely, you want to get annual eye and kidney exams. And I might add, it's not on here, but check those feet. Make sure somebody is checking your feet every day, because there is, as a complication of diabetes, you can get peripheral neuropathies, which means that the peripheral nerves are no longer working the way they should. And as a result of that, you may lose pain sensation in your feet. So you can have an injury to your feet and not know it, or you could have a toenail that's growing in and that is set up for infection and not realize it. So that's why you want to make sure somebody is checking your feet too. You want to avoid smoking. There are just a cajillion reasons why you need to avoid smoking. This is just one of them. And then finally, you want to manage your stress. We all know that we're in a stressful environment, but the secret is how you manage that stress.
Go to the next one.
So our takeaways are prediabetes is it is highly possible to reverse it. And you can reverse it with lifestyle changes and, if necessary, medication. Those lifestyle changes that we talked about, diet, activity, and sleep. And remember that GLP-1s have been found to be helpful, and dopamine impacts your health.
Yeah, Dr. Hines.
GLP-1 drugs and how do they work? So they mimic your natural gut hormones. They will, and that causes a boost in insulin, a slowing of the rate that your stomach empties, and a reduction in appetite. And the result of those things is better sugar control and weight loss.
Keep going.
So GLP-1 stands for glucagon-like peptide 1. So glucagon is the natural hormone that your body was already making. So these medications help control blood sugar, they reduce your appetite, and they support weight loss. And examples of them are semaglutide, which is marketed as Ozempic, and tirzepatide, which is marketed as Mounjaro.
Go ahead, keep going. Next slide.
So there are side effects with some of these drugs. And a very common one is nausea. So, and the root of the nausea is, like I said before, we slowed your stomach emptying. So you put the food in, and especially when it's newer to you, when the medicines are newer to you, and you're figuring out how much you can eat and what makes you feel nauseous, you've put the food in, and now instead of that food moving out of your stomach, let's say quickly, right? Now it kind of sits there, right? And that's kind of where the root of some of that nausea lies. So what they're suggesting to try to avoid that is to start low, as far as low in the dose, right? And go slow as you are titrating up on your dose. Eating smaller meals, avoiding greasy foods, staying hydrated, because dehydration is a very common problem that we're seeing, because again, when you feel full, right, you're not tempted to put anything in there. So even water. And even though you feel full, you may not be getting the hydration that you need. And then if the nausea persists, then you want to contact your doctor and make sure that your doctor is aware of any of the side effects that you're experiencing.
And the other thing these drugs do, they make you pee out your glucose, so it's easy to get dehydrated even more because you're peeing more, urinating more. So next slide, Simon. So the GLP drugs, beyond weight loss, we know it's not used just for weight loss anymore. Studies now show that these drugs may lower the risk of dementia, they may lower the risk of stroke and heart disease by reducing inflammation and improving blood flow to the brain. So also, next slide, what some people are advocating now, although it's not official, it's not necessarily FDA approved, but they're microdosing, which is a trend to watch. We don't have evidence that it's good, but a lot of people are doing it, one, for cost, because these drugs are so expensive, and that's what the administration is doing now with Eli Lilly and others. But so take a very small dose of medication, and that might also lower the side effects. Some people discuss this not only for cost, but it gives them more energy and might be effective with increasing your longevity. But they're still lacking clinical proof. Next slide. Dr. Neighbor Stevens.
Ooh, the power of walking. You want to aim for 5,000 to 7,500 steps a day. Some of the newer recommendations are actually now saying that as few as 3,000 a day can be as effective for achieving the good health outcomes that we are trying to achieve. With walking, we can help lower the risk of dementia, heart disease, and early death.
And do the next if you would.
Older adults should try to walk 3,000 to 5,000 steps daily. It has been shown that this helps to delay cognitive decline by 3 years. 5 to 7,500 steps a day, delayed it by 7 years.
Which one should we do? That's the 3 or the 5? I'm being funny.
Well, I paused before I answered because that's a good question, not from a medical point of view, but considering if you're talking about senior citizens, which I think is what you were trying to talk about, there are things that can, besides just not wanting to do it, there are some significant barriers that have to be overcome sometimes in order to be able to actually achieve that goal. If your neighborhood is not one where you feel comfortable walking, that's a consideration. Personally, tomorrow for me, the high is only going to be 44 degrees. I have no desire to go walking outside. I'll just be honest. I have no desire to
That'll
walk
make
when it's
sense.
really cold. So
That'll make
I'm just bringing the reality into this subject. You know, it's one thing to say, yeah, you need to do 3,000 to 5,000. But yeah, how are you really seriously going to get there? So safety, ambient conditions,
And
other
even
conditions that
balance.
you might have, like arthritis or problems with your feet, can make it problematic. One thing that I would suggest to try to overcome some of the barriers is always more fun, and you tend to be more consistent when you're doing things with somebody. So if, one thing you can consider is to try to find a walking buddy so that between the two of you, you can, or three or four of you, you can look out for each other and keep the motivation going. But what I was supposed to talk about, sleep apnea, the hidden risk. Sleep apnea is when breathing stops briefly during sleep. It increases the risk of stroke and heart disease and memory problems.
Keep going.
Well, that's the end of that slide. So the therapy for it is CPAP. But before we get to the therapy, I wanted to bring up the issue of snoring. Because what we said was that you have interrupted breathing during sleep. But how do you know if you're asleep or if there's anybody else in the room with you? How do they know? So sometimes the cessation of breathing can be so significant you wake yourself up. But if that doesn't happen, one of the signs that can trigger getting a test for it is if your roommate tells you that you're snoring so loudly. So you treat it with CPAP, which stands for continuous positive airway pressure, which has been shown to reduce heart attacks and stroke risk, which is in high risk patients is used consistently. I'm laughing because the rate of consistent CPAP use after it has been prescribed is atrocious. And one of the reasons, again, I'm just trying to be real. One of the reasons it is not adhere to is because it's uncomfortable and cumbersome. So I just want to make it clear that yeah, the ideal is that you slept that mask on every night when you go to bed. But the reality is it's so bad that insurance companies typically require that you provide documentation, which your doctor can tell by a knob on the machine. Consistent use. And if you don't consistently use it, your insurance company can refuse to pay for it.
Now, one of our speakers a couple of weeks ago, the dentist, they have some oral appliances that can reduce sleep apnea without the CPAP machine. I haven't seen those, but she mentioned it. You remember the details of that?
Yeah,
He
they
did
do it.
for
Oh, go
mild.
ahead. No, go ahead, Jocelyn.
Yeah, they do, but they're for mild sleep apnea, right? So once you've moved into the moderate, and if we're talking about alternatives, there are oral appliances. There's also a new, well, relatively new. There's a surgical implant that you can get. There are like the nose strips. Like there are a number of lifestyle things that you can do for mild sleep apnea, including elevate the head of the bed, don't drink alcohol and go to so half these people are snoring because they were drunk when they went to bed, right? And that's why they're snoring. Like there's a lot of things that you can do for milder sleep apnea, but once you've moved into moderate and severe sleep apnea, um, then a lot of those oral appliances and things like that, you're beyond that, right? Because the amount of pressure that you're trying to overcome is greater than what the adjustments that just opening your airway more, opening the part of the airway that you can see more can overcome. Because the reason for continuous positive pressure is because essentially when you're asleep, what in the context of obesity, which is kind of where we're talking about it here, the weight of your chest, right, is so great. And this is another issue for women with large breasts as well. The weight of your chest is so great that when you are asleep, your muscles are relaxed, and your muscles are not generating enough force to push your chest back up, right? And open your lungs enough to breathe. That's the short of it, right? And when you have a lot of neck fat, same thing, right? When you are asleep and those muscles are relaxed, they're not generating enough force to keep those airways open. So that's why the oral appliances aren't going to do anything if the problem's further down in your airway.
Thank you. I made these next few slides for Dr. Hines and Dr. Neighbor Stevens to dominate. So will you start off with this, Dr. Neighbor Stevens?
Common types of hormone therapy. Menopausal hormone therapy generally consists of a combination of estrogen or not with progesterone. Birth control pills are another form of hormonal therapy. Gender affirming hormone therapy, the name speaks for itself. You're being treated with hormones. And these medications can be given in various ways, either by pills, patches, gels, or injections.
Okay, go to the next one.
Excuse me. Menopause is defined as 12 months without any menses occurring. Now, there's a whole nother conversation around perimenopause, but we'll just stick straight to menopause here. And then symptoms. Well, some of the symptoms, I'm not going to say these are all the symptoms. Some of the symptoms are hot flashes, dryness, mood changes, and bone loss. But you left out maybe one of the biggest ones, which is sleep interruption.
Okay.
All right, so the Women's Health Initiative, which was considered a milestone study of thousands of, I forget now how many, but thousands and thousands of women. And they found that there was higher stroke risk, VTE. What is VTE?
Venous thromboembolism.
Oh,
Oh,
So
okay,
blood clots.
thank you. Breast cancer in risk in older women. And it led to significant revisions in guidelines back in the day. And notice I said back in the day.
I want to bring up one thing, and that's if a woman who's in menopause, and all of a sudden she comes in and she's say 70
You're
years.
kind of mumbling, Dr. Maxey. I didn't catch what the actual question was.
So let's say a woman's in menopause, and she's now 70 years old, and she comes in and said, "Doctor, I started my period again." That's a no-no, right? That's a pretty
That's a
good.
significant warning sign.
Yeah, that is a urgent issue that needs to be evaluated, and because your biggest concern, you have to rule out endometrial cancer, right? That's gonna make those lights flash.
Okay.
That's not the only reason it can happen, but that's the first thing you have to make sure that it isn't.
Okay. What's the next slide, Doctor?
The benefits of hormonal therapy. They are effective for hot flashes, vaginal dryness, bone health, and there are possible metabolic benefits if they are started early.
Keep going. Next slide.
Hormone therapy and blood clot risk. So estrogen increases your clotting proteins, and subsequently that raises your risk for DVTs or deep vein thromboses and PEs or slash pulmonary embolisms. So there is a higher risk with being over the age of 60, being overweight, smoking, having a family history of clotting issues, or immobility. And then transdermal estrogen, which can come in patches or gels, have a lower risk of causing these issues than oral therapy.
Let's keep going, Doctor. Next slide.
The risks of hormonal therapy. So there are risks associated with an increased risk of breast cancer if you're talking about combined therapy, which is utilizing estrogen and progesterone together. There's an increased risk of cardiovascular disease and stroke. And there is potentially an increased risk of venous thromboembolism or blood clots with the oral estrogens.
Okay, I think we covered the last. Skip a slide.
So before I'm not sure exactly how far we're going to go, but one of the things that happened after that Women's Health Initiative study is all the doctors got scared, right? And then we stopped prescribing hormonal therapy to perimenopausal and menopausal women almost because we were terrified, right? We were like, oh no, all of these things, are happening. And then some of that, I think, is the root is linked to why there is so much discussion now about perimenopause and menopause, is because for a period of time, our solution was suck it up, right? And just kind of deal with it because all of these bad things can happen. And now we know better that there's an asterisk with these things.
So I call a hot flash is a power surge. Dr. Neighbor Stevens?
Oh, this is the right slide for me. What is VTE? VTE means venous thromboembolism, otherwise known as a blood clot in the vein. It includes deep vein thrombosis, and which is to say the veins that are deeper in the leg, as opposed to the very superficial veins, and pulmonary embolism, which means blood clots that get carried away from their source, usually in the legs, into the veins of the lungs. A DVT, a deep vein thrombosis, can be a clot in one leg. Sometimes it can be in both legs, depending on the cause. And there is a risk. They don't always travel to the lungs. Most of the time they do, but they don't always um, travel to the lungs, where they block the blood flow in the lung and prevent appropriate exchange of oxygen into the blood, and can be fatal.
Next slide, Simon. So why hormones affect clotting? So estrogen increases clotting factors that are made by the liver. Oral hormone therapy has a stronger effect than skin patches. This can make blood stickier and more likely to form a clot. Next slide. There are also cardiovascular risks as well as VTE risk. Oral estrogen increases clotting. Transdermal is safer. And early initiation, less than 10 years, improves outcomes. So as early as you can get it, the better it is. So who is at risk for VTE? Next slide. The family with a personal history of blood clots, people who smoke. Why does smoking come up on every single disease we talked about? I wonder. Obesity, or long travel without movement, genetic conditions such as factor 6 latent disease, older age, or higher hormone doses. You want to do the next one, Dr. Hines? Symptoms?
Sure. Symptoms to watch out for. Signs of a DVT or a blood clot in the leg are leg swelling, pain, warmth, redness, commonly in one leg, but can happen in both. Symptoms of a pulmonary embolism or PE are sudden shortness of breath, chest pain, a fast heartbeat. And if you are experiencing or concerned about either of those, you want to seek medical attention immediately if that is what's suspected.
Okay.
If I could jump in just a minute and add that the sudden development of DVT or PE can sometimes is often associated with certain forms of malignancy and can be the first time any concern has been raised about what's going on. In other words, you can think that you're just perfectly healthy, but the malignancy can be cooking along and you have no idea that it's there, but it causes the DVT or the PE. And so when you have these occur, frequently there is a moderate workup to see if there are any underlying causes.
And actually, that PE can save your life. They can find the cancer.
Right.
So go to treatment options. Next slide.
Treatment options: blood thinners, anticoagulants like warfarin or apixaban, compression stockings, and leg elevation, and then hospital or home care depending on the severity.
Yeah, apixaban is Eliquis. Okay. Go to the next slide if you would, Dr. Hines.
Safer hormone options. There are transdermal skin patches for estrogen, and those have a lower clot risk. Progesterone-only pills or IUDs are thought to be safer in the context of blood clots because they don't have estrogen. And then non-hormonal alternatives are also available to address hot flashes.
And Dr. Neighbor-Stephens.
Lifestyle and prevention. Again, you want to stay active and you want to stay hydrated. You need to stop smoking. You want to maintain a healthy weight and you want to have a very honest conversation with your doctor about what choices you have.
Keep going. Next one. Dr. Neighbors, take next.
Key takeaways. Know the warning signs of VTE. Ask about safer hormone options. Balance the benefits and risks carefully. And remember that early recognition saves lives.
Yeah, I think we're gonna end it now. We're at the top of the hour. But as you can see, almost everything we've discussed today does boil down to lifestyle changes, eating healthy, exercising, the same thing we've talked about for weeks and weeks. So it's very important that you be woke, that you know how to protect yourself, that you know how to exercise, eat right. Let's talk about final comments for the day. Dr. Hines?
So thank you again for covering this topic. You mentioned in one of the slides about how dopamine is important for your health or impacts your health. And I just wanted to just give a snippet on that because I had to think about it too. And part of it is dopamine is your feel-good hormone, right? And it's really part of your reward-driven eating is where it kind of falls into the diabetes and the obesity space. So if your dopamine is not well regulated, well, your hunger is going to feel stronger, even if your energy needs are met. And then that processed food and the things that aren't so good for you are going to feel more comforting if your dopamine needs aren't met. So I've learned several things today too about, I'm a crunchy person, so I like crunching. And I was like, oh, well, I'll have to think about when I want to crunch. So thank you.
Thank
So
you.
my takeaway today is I don't want to, what I'm about to say, I'm not trying to oversimplify anything. There's a lot of hard work and that has been done to look into all of these things from a scientific basis. But I don't want the audience to walk away feeling overwhelmed. It is not really that hard to follow these simple ideas that we're talking about in order to maintain good health. The key thing is knowing, and we've been talking about it. So, the mommy and me is saying, I done told you this. Now, it's all about putting it into effect. So I want to encourage the audience to integrate what we've been talking about now for several weeks into their lifestyle. It will help. It's not a cure-all, but it will help.
Well, thank you so much. So, as my takeaway, I think next week is the 16th, and we're going to have a return of one of our superstar presenters, Dr. Ron Bailey, who's been elected president of the Association of Black Psychiatrists. And he's going to grace us with his presence on the 16th and take into heart what Dr. Hines and Dr. Neighbor Stevens are saying, that this is not a daunting task, but it's being smart about your body, know your numbers, take care of yourself. Thank you very much, Simon, for helping today. Thank you to our co-moderators. See everybody next week. Have a great day. Enjoy your Sunday.
Bye-bye.
Bye.